Okay, so some of you might have seen this already. The Florida Surgeon General, in all his wisdom, says they're going to try to eliminate the state vaccine mandate. Dr. Wolfe, I'm a forensic pathologist. I am also a regular surgical pathologist, and I have a degree in microbiology. So I know a fair amount about infectious disease. So the argument here is that the government shouldn't have a say on what you do to your body. Now think about that for a second. It's a little bit, just think about some events that have happened over the last couple years and think if that makes sense. Ask yourself, has the government ever told people what they can and can't do with their body? I think there's a pretty big issue that's happened over the last couple of years where they did do that. Now, of course, it's not exactly the same because in this case, families will get to choose whether their child can be patient zero and go harm other people. Now, of course, if this goes through, you'll have a lot more infectious diseases. See, the dream is that people think infectious diseases like measles, mumps, rubella, diphtheria, tetanus, they don't exist because we don't see them. But we don't see them because people were vaccinated against them. Those organisms that cause all of those things, they're in the environment right now. That just look at the measles outbreak out west. So when you stop vaccinating below a certain amount, then of course you start to erode herd immunity, and then people will start getting these old diseases again. You're going to have kids in Florida with mumps. And in general, what's going to happen is immunosuppressed children and elderly, and there's a lot of elderly in Florida, are going to be harmed by this. So what you're doing is Florida's health apparatus system, state of public health is going to look like pre-1930s United States. I suspect that what will happen is they will remove the mandates, and then they will also remove the reporting for vaccine preventable illnesses, which will have this effect. They'll say, we remove vaccine mandates and we don't have any diseases going around. They just won't be reported. So then that will cause the public to say, oh, well, we never needed them to begin with. And then that will compound itself, and more people won't get vaccinated, which will cause more and more people to get vaccine preventable illnesses. So if you're young, old, or immunosuppressed, going to Florida to visit for tourism or something like that's probably going to be a pretty bad idea here in the next couple of years. But avoiding Florida is not going to affect anything because those Floridians who are little patient zeros are going to be flying to and driving to other places and infecting other people with their diseases. So again, we are moving to a pre-1930s, 1920s America. That's what happens when you let people get in positions of power who don't understand the implications of their actions. And the greatest trick of all of this, probably the most insulting thing, is that he's vaccinated, his whole family's vaccinated, the governor and his whole family is vaccinated, and every person that will vote this through is vaccinated, and so is their children. So it'll only be harming people later who come after this ruling comes down. And that's just incredibly sad, but it is what it is. It's going to come to other states as well. It will come to my state as well. I live in Indiana, so they'll do whatever these other people do. So, get ready for that. And I hope you studied hard for your microbiology when you were in school. If you're a medical student, I hope you read about those old infectious diseases. I know that when I started medical school in 2000, I was taught by an infectious disease doctor who was basically sort of chuckling at the idea of having to teach us about diphtheria. And here we are, 25 years later, and I'm going to have autopsies from it.